So, Dr. Ward, my senior cat, who is 19 years young, has trouble getting up the stairs these days. Am I helping if I carry her, or is it better to let her continue climbing on her own?
Well, first of all, congratulations on having a 19-year-old cat. That's pretty remarkable. And one of the things that I'm very excited about is to talk about the IAM's new Senior Plus formula because it was designed with cats just like yours and mine because it has a unique formulation for dogs and cats that are 11 and older. Because as you are witnessing with your 19-year-old kitty, that things are different. We're not the same as we were when we were 8, 9, or 10 years of age. And one of the things that I would like to comment on, just from a nutritional standpoint of your 19-year-old kitty, is the need for more protein. You mentioned there's some perhaps arthritic pain or difficulty getting up down the stairs. Many times in my practice, these cats are also having severe muscle loss and muscle weakness, and it's often due to cachexia or a lack of adequate protein. So I want you to make sure you're feeding a diet like the IM Senior Plus that has adequate high levels of protein for your older cat. The reason is that older cats can't digest proteins as well as they could when they were younger, so they require actually higher levels of protein than lower. Now, it's very true, cats do get osteoarthritis, so I want you to talk to your veterinarian and find out if your cat would benefit from perhaps some medications. Non-steroidal anti-inflammatory drugs have been used in my practice with great success in older arthritic cats, so talk to your veterinarian about it, but more importantly, make sure you're feeding the right food, and something like a formula is IM Senior Plus.
So, am I helping if I carry her up the stairs, or is it better for her to keep climbing?
Right, again, you've got to determine the cause because if there's muscle wasting, perhaps more physical activity can help. But if it's osteoarthritic pain, you need to talk to your veterinarian because you're going to have to get some anti-inflammatories.
Great, thank you. So, we also have a 15-year-old male mini poodle, and he has nighttime urinary frequency. He's tested negative for diabetes, kidney disease failure, stones and cancer. He takes tramadol and Rimadyl for arthritis, but is otherwise, pretty healthy. What could be causing this, and why did the antibiotics that the vet gave him help for just a short time?
Right, obviously, I mean, this is a specific case that only your veterinarian can adequately answer those questions. There could be many, many possibilities. I would encourage you to continue, working with your veterinarian to get a specific diagnosis and so you can help your little buddy.
So, my cat is 19 or 20 years old. She has arthritis in the hips and is unable to properly groom around her hip area due to flexibility restrictions. So, how can we help her stay nice and unmatted?
Right. Well, certainly this is common in older cats, and this is again one of those unique changes that we start to see. You mentioned decreased flexibility and osteoarthritis, and one of the things that the IM Senior Plus did for these older cats and dogs is they boosted not only the antioxidants but also the omega-3 fatty acids, which are anti-inflammatory and can help with the coat. You mentioned the coat gets matted, maybe it's flaky as well. Also added L-carnitine to help promote lean muscle mass, so we're trying to get those muscles nice and strong, and glucosamine and chondroitin to help with arthritic pain. So I think diet is a critical part of this, but more importantly, I want you to make sure you're doing all the good grooming stuff, brushing once a day, and really talking to your veterinarian because when I see decreased flexibility, it's often as a result, as we mentioned earlier, of decreased muscle loss or tone and osteoarthritic pain. So we want to get your kitty some pain relief, it sounds like.
So, is it healthy for my senior cat to eat dry food even though he can't chew the food thoroughly? He only has a few teeth. I give him both dry and canned food, but he continues to want the dry food.
Right, and we have many, many patients that they prefer that as well. What I usually do with my older cat patients that like you've described is I will tell owners to moisten it with warm water. So maybe 5 or 10 minutes prior to feeding, add a little warm water to it to soften the kibble, and that can ease difficulty in chewing or swallowing.
So, I think that's it with my questions. Is there anything else that you'd like to tell me or tell our readers? Um, Go right ahead.
Right. Well, for me, being a veterinarian, practicing, veterinarian, it's always exciting to be a part of something new, and that's really what we're here to talk about today, and that is the IM Senior Plus formula. Currently, it's the only thing for older, dogs that are 11 and older, and certainly when I look at the needs of these geriatric and senior plus patients, they've really done a great job. They've added the antioxidants, as I mentioned. They've boosted the omega-3 fatty acids. They've added L-carnitine. I mean, when I looked at the nutrient profile of what they were accomplishing with this diet, it was pretty impressive. So I really want to get the message out that dogs and cats at age 11 are different than they were when they were 7 or 10, and those nutritional needs have been met by I Am Senior Plus. So it's pretty exciting, and anytime you can be part of something new, certainly do it.
Are these formulas available now?
Yep, these diets are available. They can buy them at major retailers, Walmart, PetSmart, Petco, Target, all of these places. So all of your readers will have easy access to the I Am Senior Plus.
And is there anything that we can do online for them?
Online?
Can we find out any information online?
Yeah, if you want more information, I would go to iams.com. But I will give you a little bit of a tip. Coming in April, there's going to be a neat Facebook contest on the IAMS Facebook page. So go to facebook.com/IAMS. Go ahead and like that page, because your readers are going to want to get some of these prizes. It's really, really a lot of fun.
Great. Thank you so much, Dr. Ward. We really appreciate it.
All right, thanks for having me.